and welcome to TheraTalks. My name is Fiona.
And my name is Kay.
And today we have a very special guest, Dr. Norman J. Almeñana.
Hi.
Doc, can you introduce yourself, Doc?
Okay, I'm Dr. Norman Almeñana. I am an orthopedic surgeon.
Doc, explain a brief explanation for plantar fasciitis.
Straight to the topic, no? So plantar fasciitis, actually it's inflammation, commonly inflammation of your heel pad. Pain on the heel pad is commonly associated with pain, and some patients report numbness of the heel pad, but actually it's more on micro tearing of your plantar fascia. Your plantar fascia, as you know, that's like the web of ligaments on the inferior part of your foot that controls the arch. That's the possible problem.
Okay, thank you, Doc. So, who are the people commonly affected by plantar fasciitis, Doc?
Okay. Actually, it's common in middle-aged adults, commonly runners, especially people on the running era, as they say sa atin, on this age group, middle age. And then also those people who stand for long hours, like teachers, surgeons like us. Actually, I do have one before, and I treated myself. Those are the particular population group that has it. People who are runners, active in middle age, and people who are standing for long hours.
What signs and symptoms should people watch out for?
Actually, the classic symptom is a sharp heel pain during the first few steps in the morning. And usually it's relieved after a prolonged rest, and it usually improves with slight movement, but again it worsens after a long activity. So people or our patients, sometimes they rub something on their foot, but actually it doesn't really help. So they just slight stretching relieves the pain. But then if they resume their work, the pain goes back again.
Okay, Doc. For the next question is, how does plantar fasciitis affects a patient's daily activities and quality of life?
Okay. So it can significantly affect walking, exercises, work productivity, and the overall mobility of the patient. So because it's some patients experience it for a long period of time, let's say weeks up to months, so it can be considered chronic pain already. So once it becomes chronic, it really affects the activities of daily living of the patient, and of course the weight of the patient, because it's directly proportional. So because there's increasing pain due to the chronicity of the disease, the weight also increases. So there are reports that some people who have plantar fasciitis have weight gain. So those are some of the symptoms of plantar fasciitis.
For last question, Doc, what advice would you give to people who may be experiencing symptoms but are hesitant to medical help?
I advise my patient to have early treatment. So as soon as possible, as they experience the symptoms of the heel pain, they have to consult already before it becomes a chronic pain. So simple interventions, again, as I've mentioned, relieves it, like stretching. Also, proper footwear, soft soles, weight control. It's a symptom, and at the same time, it's an aggravating circumstance for the plantar fasciitis. And of course, physical therapy, which is highly effective for plantar fasciitis.
Thank you so much, Doc. And thank you for giving our viewers a very inspiring knowledge. for today for plantar fasciitis case.